Welcome back after the break. And as we talked earlier, we mentioned a lot about what medical tourism is and who it targets. And I'd like you to explain briefly about the advantages of or the improvements that you'd like to see from your perspective about the medical tourism industry here in Thailand.
Good. Thailand needs to be aware of the fact that medical research advances very quickly everywhere. Science today is so advanced that we can manipulate, meaning we can clone, we can re-establish tissue, we are using stem cells, and we need to be updated all the time. This is one of the points that the Thai medical professionals need to stay always updated on, and I would say luckily most of the medical professionals we are having in Thailand have been educated or have trained abroad, so they have no difficulties in catching up. But it is very important. I also think that we are going to face sooner than later a capacity bottleneck in the numbers of qualified doctors. And at the moment we are having a situation that in Thailand, for example, only Thai nationals are allowed to practice. We are having many supervisors and advisors coming from top other destinations, top researchers and so on. They would try to assist the local doctors, physicians or the hospitals in a supervisory position, but they are not allowed to involve, in my opinion. But this is a matter of legal situation. The government needs to establish the whole framework for this. I think that it would be of advantage. It will improve and heighten the quality here very much, meaning that nobody can compete. If we will not do it, another country will do it, and then people will divert. And what we also need to remember is that medical tourism or healthcare travel is dependent very heavily on economic situations. And at the moment, again, we are having an economic problem that the Thai currency is overvalued in a way. For the industries in general, we are having problems in exporting because we are too expensive. People who come here to buy medical treatments look at the exchange rates. And during the last year, because of the overvalue of the Thai baht, the euro lost about 20%. The US dollar, we cannot blame Thai for this, you see, but that's the situation. People start looking around where they can get better exchange rates, which will make the price of the treatments and the price of staying in Thailand, because the people do not come alone. See, they come in families, they go shopping and so on. They look at the total balance at the bottom line, and we need to be aware of this, that we keep Thailand attractive to these people to keep coming.
There are many different factors, actually. When we think about medical tourism, we often think about just hospitals and patients, but actually it's an all-encompassing cycle itself. And as you mentioned, whether it is exchange rates and how people feel, the service. And I'd like you to briefly mention about the different human resources here in Thailand and whether or not, at present, do we have enough qualified students, whether it is in the service sector or the different doctors coming up. Or is this a problem here in Thailand, or is it a possible shortcoming?
Well, I would say right now we are within capacity with difficulty, meaning we have physicians coming back. The problem again is that those physicians who come back highly specialized from other countries face here a low salary situation, and they will consider whether they would like to stay or not.
Or work abroad.
So abroad, you see, if we earn a salary in Thailand and we go, for example, to my country of origin, which is Switzerland, everything is 30 times more expensive for the same thing. If the doctors will go and work there, if allowed, this is always the same situation, they will have, of course, a salary which will allow them later to come and retire in Thailand very comfortably. So it is a matter of, first of all, keep or let's say, prevent brain drain, how do we attract all these good qualified doctors to come back? And since they have to be Thai at the moment, we need to bring in Thai doctors from the United States, from England, from wherever in Europe they are. There are several nursing schools in several universities around. The major problem we are addressing with international visitors at the moment going to hospitals is the lack of language.
Yes.
Because in the nursing school they will teach them how to treat you health-wise, but they will not teach you how to communicate.
Yes.
And this is a major hazard we are having here, even with physicians sometimes.
And also, Professor, not only in English itself, but different languages from, because I'm sure that the patients come from a variety of countries.
That's correct.
And which country would be the largest or top 3 target audience for consumers here in Thailand?
Well, at the moment, the Middle East is the major contributor. We are having, out of the 1.5, I would say we are having about 40% of the visitors, if not even more, coming from Arabic-speaking countries.
Yes.
Most of the hospitals are prepared for this. They have Arabic-speaking personnel when it comes to escort and translation.
Yes.
Most of the international hospitals today have what we call, for the pre-appointment or pre-selections, they're having English-speaking staff, mostly Filipinos. There are Thai around as well.
Yes.
But what I'm saying is not enough. This is a point we need to improve.
Yes.
And as for, I would say, currently we have a good capacity of rooms in hospitals. We are talking about 10 to 12 international hospitals, with more coming up. And we should not forget that other countries have English, or the most important language, as a native language, and they will have an advantage over Thailand in this point. No one can rival with Thailand in terms of friendliness. The hospitality is at the moment on top of top.
And also, lastly, I'd like you to further elaborate about, from your point of view, how the government or the different agencies involved are doing their part in terms of marketing medical tourism to the rest of the world.
Well, TAT is putting a lot of emphasis at the moment in promoting Thailand as a medical destination.
Yes.
Okay. Now TAT does not involve in the medical side. They do not talk to the hospital about how to manage their business, but they are doing promotion.
Yes.
The government should be more involved in setting standards, and this is probably where the PATA Healthcare Travel Task Force will try and help in recommending standards, because we need to talk about, see, one of the most, let's say, sensitive points is that we are having a matter of liability. When we talk about English-speaking countries, saying like United States or Australia or England, people there like to sue. Their legal system allows them to do it. It is very difficult to do it here, but it is possible. It is not possible to do this in China. This is why a lot of people do not go to China, because
so it's out of the list.
because they are afraid that if anything is going to happen,
there's no system to fall back on.
They have no one to talk to who will respond to them. As you may know, the government in Thailand is now following the malpractice legal system, and they're trying to put it into law, into practice. We need to improve the insurance interface system. See, one of the points is that many Europeans do not come to Thailand because they are very well insured in Europe. Their insurances will tell them to stay there, as long as we have no bilateral agreements with the insurances being able to pay cross-border, which in the Eurozone, in the European Union, for example, is now possible, but they will not support anyone coming
outside the region.
Exactly. So this is a matter which is going into government levels or into top insurances and so on, we will need to try and improve this as well.
Yes. Well, thank you very much for joining our show today and also talking to us in a lot of detail about medical tourism and the potential here in Thailand. ขอบคุณค่ะ
Thank you very much.
Thank you. Thank you very much for staying tuned and watching this episode of NNT News Talk. สวัสดีค่ะ